Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to talk about what's new in wound care. So new technologies, new things that have come out. So really that's what we're going to talk about today. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started here, guys. So chronic and non-healing wounds, they are a worldwide issue, and they are becoming more and more difficult to treat as more people are having more serious health issues and comorbidities. So in the United States alone, over 8 million Americans have chronic wounds, and it does cost the national healthcare system between $18 and $96 billion every year. So obviously, this is a very big issue. So a lot of times, if standard treatment isn't working, we do need to go to advanced wound care methods. And really, that's what I'm going to be talking about today, the different methods and just really new technology that we can use in wound care for those difficult, hard to heal wounds. So this is actually an amazing tool that almost all wound care nurses and professionals can use, and it is so underused. Picture imaging, okay? This really gives you that good visual reference of how a wound is healing, okay? Because I have seen it so many times where a wound is measuring the same way. Now, when we measure a wound, it's the biggest length by the biggest width. So sometimes you have the wound is actually getting smaller and you can physically see that it's getting smaller, but it's measuring the same because you're looking for that longest length and the biggest width. So sometimes it's closing in, but it just happens to be the same measurement. Okay, so picture imaging, 100% awesome. I absolutely love it. And then you can see exactly the progression. So next we have thermal imaging. Okay, now these are really cool images because it allows us to look at the physiology of the actual wound, see if it's able to heal. Okay, so these images are actually giving us and showing us the ability of this wound to heal. It also provides us with early warning signs if it's a chronic wound. Okay, because a lot of times when we're over that, say, 4-week mark, not healing wound, sometimes wounds are not going to heal a long time before that, but that's when we're noticing it because it's not healing, right? So a lot of times we can catch this early and start doing more advanced treatments to get the wound and have a higher possibility of the wound healing. Because once that tissue has been open for so long, it really doesn't want to close. So when we catch a chronic wound early, it has better odds of healing. Fluorescent imaging. Okay, this is another really cool one. So microorganisms, they emit an intrinsic fluorescent signal. So when they're exposed to specific wavelengths, they can be detected and analyzed. Okay, so this really shows whether or not a wound has bacteria present over the wound. Okay. Our bioactive dressings, I added this. This isn't something really new, but I thought I would just add it on here. It's all of our dressings that do contain healing properties, growth factors, collagen, elastin, skin equivalents, okay? Even down to our alginates. So these all help either whether they are natural or artificial sources. They do help in advanced wound healing. Next, we have pressure mapping. So this is really great for people who tend to get pressure ulcers a lot. So the clinician, they do have to be trained in this specifically, how to read these. And then we would know what devices we could use to reduce pressure, to reduce the chances of pressure ulcers. Because in wound care, what we want to do, the main goal of wound care is prevention. Okay, prevention over cure. Really, healthcare, unfortunately, the model isn't there yet. But that's how all healthcare should be. It should really be prevention over cure, because we're right now we only go to the doctors when we need to cure something. But really, the focus should be more on preventing problems, preventing heart disease, all these different things, cancers, etc. That's really what we should be doing, and wound care is no exception for that, because especially in wound care, we always have to go back to the preventative measures to be able to heal the wound. So, and then there's just so much more involved. So if we're doing the preventative measures to begin with, it's so much easier. Next, we have shockwave therapy. Okay, so this is a non-invasive treatment that uses biphasic high energy acoustic sound waves to promote wound healing. Okay. Next, we have our topical oxygen therapy. Now, this is actually the first time I did a bunch of research on this, but it's really, really cool. It's not something that I've been able to use in my practice here in Canada yet, but I have found it in other places. Super, super cool. So it's really adding oxygen to a wound, a chronic wound that has failed to respond to conservative treatment. Okay. So there is two different methods. They have this one where this is sealed and the oxygen is being pumped in. Now they also have this little pack here, which I thought is really cool. You add this over top of the wound and it provides the oxygen to the wound. So super, super cool. New technology here that I found. So chronic wounds are a major concern, clinical concern all over the world, and they have a negative impact on quality of life and truly do affect the patient. Having wounds, it's not easy to live with, okay? The patients can really become self-conscious, not want to leave. They just don't want to be questioned. So it can really impact the patient. So understanding the biological process that occurs in the wound bed can help clinicians optimize wound healing. Some wounds do require advanced technologies to overcome any obstacles and actually start healing. So we want to just be aware of the technologies that are out there, what's new and what's available to us, because when we have this knowledge, then we can use it, right? So I hope this video did give you a better idea of some different technologies in wound care and kind of what's been coming out, and even some that you know, have been there and maybe you're just not aware of. So I hope this video did help you, but that's all that I have for this video, guys. I hope to catch you in my next one. Bye for now.